Guys, this is Dr. James Kennedy, Texas Foot and Ankle Centers. We have a patient here that was complaining of a hurt toe. And I see these all the time, and most of the time, if they're like this, I usually just recommend removing it. You can see how this nail was growing laterally. This is medial, this is lateral. It was growing laterally. And what happened was, I'm sure in the past, she damaged it, and the nail was not attached to the nail plate. Well, obviously when you remove this and it's not attached to the nail plate, you have a nail that looks like this, and if you notice, there is only the growth here and there is no attachment here. So the nail's growing out, it's attached in this small 25% portion and detached on this 75th percentile portion. Well, what was happening is the nail was growing, and it was growing inward so bad that it was actually creating a distal tip wound right in here. And she said, I was having pain. It didn't, to me, it didn't look incredibly painful. But if you look at this right here, look how deep this goes inside here. So it was growing out about 1/4 of an inch inside her skin. So, you know, you see a lot of, like, for example, these crazy YouTube videos where you'll have like a bull or have these ram horns, and they'll be growing into the side of the ram's face or bull's face. Very similar here, where the nail was actually growing inward in a clubbing form into the distal tip of the toe. It was causing a wound. So anyway, we'll remove that, we'll burn this out, she'll be happy, and she won't have to mess with it. And this, believe it or not, this will all flatten out here. This will all grow back, it'll flatten out. I'll burn this out, and this will all heal up and look like normal skin, and she can just paint it like like she would paint one of these nails. But that was kind of an interesting case. Thanks, guys. Bye-bye.